Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. And this is our briefing for Monday, April the 27th. We're honored to be here on the territories of the Lekwungen-speaking people, the Songhees and the Esquimalt First Nations. There'll be a briefing tomorrow at 3 o'clock, on Wednesday at 3 o'clock, and on Thursday at 3 o'clock. This week, that's our schedule of briefings to date. And with that, I'm happy to introduce Dr. Bonnie Henry.
Good afternoon. For our update today, we'll be talking about the two time periods since our last press briefing on Saturday. So for the first period, from Saturday to yesterday, we had 39 new cases who tested positive in BC, bringing our total to 1,987. And then in the second period, from yesterday to this morning, we had an additional 11 new cases, bringing our total to just under 2,000, 1,998. So the total since Saturday, our last report, was 50 new cases here in British Columbia. That includes, over the weekend, 2 additional long-term care facility outbreaks in the Fraser Health Region at Valhaven Manor and Valhaven Home and MSA Manor. In both these cases, a single person was identified with COVID-19, and the outbreak response teams from Fraser Health have been involved in both facilities to assess and to manage the outbreaks in those cases. One additional outbreak has also been declared over from a long-term care home, that's Central City Lodge. So we have now 12 long-term care facility outbreaks that are over. We currently have 21 long-term care or assisted facility outbreaks and 3 outbreaks in acute care units, for a total of 389 people in those units or in those facilities who have tested positive. As you are aware, we have a number of community outbreaks as well, and we've had some increases with testing over the weekend at the Superior Poultry work site, where we now have 25 people who have tested positive, and there's an ongoing investigation and testing of contacts and family contacts of people from that facility, and additionally we are up to 34 people from United Poultry who have tested positive. I reported on Saturday that we had done a lot of testing at the Mission Federal Correctional Institution, and we remain at 118 cases identified at that institution, including 106 inmates and 12 correctional staff. In addition, we've had 11 people now in the province associated with the outbreak at the industrial complex at Curl Lake in Alberta, and I want to talk a little bit about that some more. I had identified that this was an issue because we have close ties between BC and Alberta around these movement of people for this essential work. Many BC residents continue to travel back and forth for the work that they have in both places, but in Alberta as well. And to date, while we have 11 positive cases, we know that there are several hundred people who are associated with that workplace in Curl Lake, and we know that they've got various degrees of information from their employer about the outbreak. So I mentioned this last week, or I made you aware last week, that anybody who has been in the Curl Lake project since March 24th or is in close contact with a worker who is ill and who has concerns needs to immediately self-isolate, and if you are ill, to contact public health. We have been given a list of names, and we are going through across the province to try and contact individuals who were associated with that. It's been a challenging process as we don't all have contact information for everybody, so I want to make it very clear that we continue to have cases reported in BC and in other provinces in Canada and Alberta that have been associated with the facility in Curl Lake, and we need people to be very aware of that, and if you do have any symptoms at all, to stay away from others and to contact us either by calling 811 or calling your healthcare provider or local public health. In terms of our case status, we now have 97 people who are in hospital in BC, and of those, 36 are in critical care or ICU. Over the last 2 days, we've additionally had 3 more people who have died from COVID-19 here in British Columbia, bringing the total number of people who have died to 103. And as always, we send our condolences and our thoughts to the families and to the caregivers of these people. We now have 1,190 people who have fully recovered from COVID-19. So I think you can see from these numbers, despite the community outbreaks that we're seeing, it's clear evidence that our sustained efforts to follow public health measures are working here in BC. That safe physical distancing and self-isolation requirements have slowed the rate of transmission, and we're now seeing a decrease in numbers. In addition, our increased surveillance testing has led us to find people in our community who are positive for COVID-19, and the vast majority of them are linked to known outbreaks now, which is an important thing for us to understand so that we know where transmission is happening in our community. We are getting close to those places where that time where we can start to open up. We need, however, to ensure that we have the public health teams that are able to quickly undertake that contact tracing, that connection and connecting people who are positive and others who have been exposed, so that we can isolate and work with them to ensure they're able to be to remain in isolation and not pass this on to the next generation, to break those chains of transmission. This is the work that we will need to do, the surveillance, the contact tracing, the testing, for the weeks and months to come. And it's what we need your help to continue. We cannot allow hotspots to flare up and to affect our communities. We have had a Made in BC approach to our pandemic, and our experience of the pandemic has been different, as we have seen across the country and around the world. And our recent challenges here in BC around some of the other things that are unique sometimes, or that we share with our neighbors, is the challenge of things like spring flooding and the upcoming forest fire season. We are very aware of how we need to manage our response to this pandemic and ensure that we're able to meet the needs that we have in the province to respond to these natural disasters as well. It's not an easy undertaking. And for example, we know that people who are working on the floods, the people who have been evacuated in this past week because of flooding, have had challenges in maintaining their ability to stay apart from others. And we know firefighters will need to work close together for the upcoming forest fire season if need be. Other parts of Canada, through this commitment, though, that we have made and the hard work of everybody here in BC, we're now making plans to ease restrictions with the understanding of what we might face in the coming months. Other parts of Canada and neighbors in the US are doing the same thing. Plans are being developed here in British Columbia and have been for the past weeks, but we are taking the time to do them right and to meet the conditions that we have and we are experiencing here in BC. Nobody wants to see a resurgence, so we are watching very carefully. Our focus is to provide a consistent framework so that different sectors know where they need to operate within. And we've done that already for many of the essential businesses that have continued to operate during the past months. And an example just recently is the guidance for essential retail food and grocery stores that ensures things like physical distancing and proper hygiene in those settings. We've also had our example that we put out last week around the industrial camp order and the mandatory infection control plans that we have in these areas. To ease restrictions, we need to know that businesses are looking after your teams as well. And this comes to light again when we look at the outbreaks that we've had in the poultry producing industry. Simply put, protecting your employees protects your business and protects all of us. So how you do that is to ensure employees can safely do their jobs while at work, and we've given guidance about how to do that. And equally important is to ensure that people are not penalized by staying home when they are ill. That is going to be so critical for all of us in the coming months. I know many people are eager to get their businesses going, and I've heard from many of you and many different sectors and individual businesses wondering about approval of their plans. The mechanism for doing that in a coordinated provincial fashion is being formulated, so please wait a few more days, and we will be sharing all the detailed information in the coming days, including where and who you should speak to about your plans. But we want to ensure that our efforts are maximized across the province. We will have a Made in BC province-wide plan, and it's built on the groundwork that we have done together and the commitment that all of us have made and all of our collective ongoing efforts. We need to continue to work together and to take care of each other and to remain, as we have been, kind and calm and safe. Thank you.
Thank you very much, Dr. Henry. I'd like to join Dr. Henry, and I know on behalf of everyone in the government and on behalf of the Premier to acknowledge and recognize that we lost 3 people to COVID-19 this weekend, 2 from Saturday to Sunday, 1 in the past 24 hours, 2 in Vancouver Coastal Health and 1 in Fraser Health. And we know how their families and their communities are mourning their loss. We mourn their loss as well. We wanted to pass on our condolences to the families involved, to the communities involved, to the caregivers involved on what is a significant loss. We believe that everyone matters when we're dealing with COVID-19. Every single case matters, every single person matters, and that continues to be the case. And we know this has been an enormous struggle for many, many people in our province. 103 people have passed away from COVID-19, and that's 103 families, 103 communities of people. And we are thinking of you and with you as you deal with your loss. As Dr. Henry said, 1,998 cases. People have tested positive for COVID-19 in BC, and currently 97 are in hospital, 36 in critical care. That's 51 in hospital in Fraser Health, 7 in Interior Health, 6 on Vancouver Island, 3 in Northern Health, and 30 in Vancouver Coastal Health. We have 4,159 vacant hospital beds. We've created the space to address potential surges with COVID-19. As all of you know, that's 62.7% rate of occupancy and less than 50%, 46.4% in critical care. People are using the healthcare system more than they did a couple of weeks ago. Yesterday we had 4,059 emergency room visits in British Columbia. That's of course down from normal levels, but significantly up from where it was 3 weeks ago. And we want to again ensure that people are seeking medical care when they need it in BC. I want to acknowledge an extraordinary group of people who have been involved in healthcare and correctional services in BC in our provincial system, and both from the Provincial Health Services Authority, which has responsibility, and of course the Ministry of the Solicitor General. In BC, I think in 2017, collectively we did something extraordinary. The Solicitor General and people involved in corrections, working with people involved in healthcare to improve the level of care for prisoners in BC. The initiative was launched when Terry Lake was Minister of Health. It was implemented when I was Minister of Health, and Minister Farnworth was Solicitor General. And I think it is one of the reasons why we've done, I think, an excellent job under very challenging circumstances in a place like Okanagan Correctional Centre in addressing challenges in our system. That doesn't mean that nothing will happen in the future. This isn't any kind of magic answer, but it's an important answer that we have reinforced healthcare in that in our prison system, in our correctional system, and we hope that that model can be shared everywhere. As yesterday, as you will know, Isabel McKenzie, the seniors advocate, gave a report here on the work that's gone on in partnership with the government, with MLAs from all parties, with the United Way, and with community organizations around BC, and of course volunteers around 211 and around supporting seniors living in community. Yesterday, Isabel McKenzie delivered a message to family caregivers who are supporting our elders through this time, that you're not alone. call 211 to be connected with the Family Caregivers Helpline. We provided additional funding, $500,000 to the family caregivers of BC to expand their helpline hours and other supports for family caregivers at this time. You can also call 211 or visit the website bc211.ca to sign up as a volunteer to help a senior in your community, whether it's to be of assistance with grocery shopping or providing a friendly virtual visit. Every effort matters, and our shared commitment to each other matters. I'm very grateful to Isabel McKenzie and the COVID-19 Seniors Working Group for bringing this plan forward, and they are MLAs Ronald Ray Leonard, Shirley Bond, Janet Rutledge, Sonia Firstino, and John Yap, and we're very appreciative of that combined effort that is, I think, making a difference in communities across BC. As Dr. Henry has said, what we're seeking in BC, as we have since January when our emergency team came together, our emergency response team chaired by Dr. Henry and Deputy Minister Stephen Brown, we have developed, I think, a Made in BC response consistently through these past few months, and it's made a real difference. Dr. Henry talked today about the unique BC approach to dealing with people returning to British Columbia internationally now, and our efforts to ensure that people do self-isolate for 14 days as they're required to do, and the supports that we are giving to people across the province is just one of many examples of that approach. And we are going to continue with that approach in the coming days and weeks. As you will know, other jurisdictions are coming forward with ideas and frameworks and plans as to how to deal with this next period, how to deal with this challenge that we've never faced before of coming out of a period where we have constrained human activity in our society in order to protect one another, how to do that in the safest possible way. As you know, and as Dr. Henry and I have said before, we have on the healthcare side of things really 5 main plans. First, to ensure and to limit as much as possible transmission of COVID-19 now and into the future. And we know the challenge of that, not just now, but months from now. Secondly, to ensure that our healthcare system is not overrun, and you've seen the actions we are taking and have taken to make sure that that happens. Thirdly, and this has to be a priority, and we've seen this with the cancellation of surgeries, but also other procedures, such as screening procedures, which we've done significantly less of in recent months. We have to do the kind of effort and put the kind of effort in addressing people who are struggling with non-COVID-19 problems in their health in BC, and we have to see that that happens. Fourthly, we have to ensure that the economy works better for people, because we know the impact of economic hardship on people's lives and their health. And fifthly, we have to make sure that as social beings, we are able to interact with each other in a continuing, in a safe way, but in a way that allows us to continue to function together as communities. So we're going to continue to pursue Made in BC approach while working with our national partners, and I think that's a very important thing to continue to do, and something that Dr. Henry does, and I do, and the Premier does consistently, working with national partners and other jurisdictions who are our partners together in this. We have our own pandemic in BC, and we've got to continue to do what we're doing, which is to be 100% all in, to follow the Provincial Health Officer, Dr. Henry's advice in our daily lives. And what we are doing is succeeding in flattening the curve. It makes possible what we may be able to do in the coming weeks and months in terms of opening things back up. But it requires a continuing commitment. And I know it requires patience and determination and dedication. I have been so inspired by what British Columbians have done. I'm simply asking that we continue to do that. We continue on this path together as we deal with COVID-19 in British Columbia. Thank you very much. Je vais vous dire quelques mots en français. Aujourd'hui, nous annonçons 50 nouveaux cas au cours des 2 dernières périodes du rapport, un total de 1998 cas de COVID-19 en Colombie-Britannique. Il y avait 39 cas entre le 25 et le 26 avril et 11 cas entre le 26 avril et midi aujourd'hui. Nous sommes attristés d'annoncer 3 nouveaux décès liés au COVID-19 dans les régions de santé de Vancouver Coastal et Fraser, pour un total de 103 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches. Parmi l'ensemble des cas confirmés de COVID-19 ici, 94 personnes sont actuellement hospitalisées, dont 36 en soins intensifs. Les autres personnes dont le test de dépistage a été positif sont en isolement à leur domicile. Merci beaucoup. Thank you very much, and we're happy to take your questions.
Thank you. Reminder for everybody on the phone, please press star 1 to enter the queue. You are limited to one question. Please also unmute your phones. You will not be audible until we call your name. First question is from Richard Zussman, Global News.
Thank you for taking my question. Oh, there's some feedback there, I'm sorry. Dr. Henry, I'm just wondering around if there is a reviewed timeline on when schools may return, and sorry about the feedback, whether people will be required to wear PPEs in the school, and were you surprised that Quebec announced a return to school for early May?
Quebec has their own pandemic that they're dealing with, and they have their own approach to it. So it doesn't surprise me. I was warned by my colleagues in Quebec that they were going to be coming out with some of their plans this week. Having said that, we've been working with the Ministry of Education to come out with our rational plan for what we're planning on doing in the coming days and weeks. And I've said this before, we don't have a date. Let me say that, but we need to make sure that we are able to provide the educational services that are needed, particularly for those younger children who can't stay home by themselves if their parents are going off to work. And that's the focus of the next little while. How do we do that and safely, and making sure we have physical distancing? The idea around wearing of masks is not something that we do a lot in our culture. It is something that we can consider in circumstances, and we've talked about that a little bit, particularly where you cannot maintain the physical distancing. But we know things like hand hygiene, like making sure anybody who has any symptoms or is feeling unwell is not does not come around others, stays home from school. We also know that the cleaning in the environment is also incredibly important, and there's ways you can do that, both physical distancing and time distancing for classes. So I know there are a lot of discussions about how this could happen for small groups over the coming months, and we'll have a plan for that coming up soon. So no specific date.
Next question is from Binder Sujjan, CTV.
Hi, good afternoon. So Ontario has talked a little bit about what reopening the economy could look like, given a bit of guidance to businesses around the phased approach that they're going to be using. And I'm just wondering why BC hasn't been able to provide even that type of rough framework yet to businesses. As you know, many of them are struggling. They've got rent coming up. They're trying to make those decisions around what they do for the next couple of months. And I'm just wondering, if there is going to be a phased approach, or if you can at least let businesses know what sort of the broad plan is.
Yeah, and we'll certainly have more details about that, but I think you have to recognize that if you look at, for example, the first phase that Ontario's put out, we have not closed businesses in the same ways that they have there. We already have people going outside. We already have essential businesses that are working, our construction businesses, and we have put in place, and I've said this many times, the guidance that people need to safely manage those businesses. So yes, we will be looking at the ones that we did shut down and coming out with more details around how they can give us their ideas. I don't know all the ins and outs of every different business, but what I'm providing is what we need to do to be able to open up safely, and we know that works in the retail sector and the grocery sector that we've seen. So there are already in place guidance for people, and we need to continue that to the areas that we did shut things down here in British Columbia over the coming weeks, and we'll have more details on that.
Next, we have a question from Marcella Bernardo, News 1130.
Hi, Dr. Henry and Minister Dix. I would like to follow up more on what Isabel McKenzie said yesterday, because it sounds like several care homes are shutting families out, even if there is no COVID-19 outbreak at those homes? And how concerned are you that there may be other reasons why families are being kept from seeing their loved ones? Perhaps they don't want them seeing the conditions inside any of these facilities where people may be understaffed or anything like that.
So that's not our understanding. And we've talked about this many times. We've put in measures across all long-term care facilities in the province, and to reduce the numbers of people who come into the facility as a way of preventing introduction of the virus into those facilities, where we know people are very vulnerable and where these outbreaks can take off very quickly. So it is across the province. Care homes are not allowing any visitors, unless exceptional circumstances where people are near the end of their life, for example. So that is a standard that we're seeing across the province that we have put in place as a way to protect all of our care homes and the seniors and elders that we hold dear in all of these homes. So it's not trying to hide anything or cover anything up. It's part of our pandemic response to try and ensure that we don't have the conditions that allow introduction of the virus into care homes in the province.
Just to add to that, we'll be providing an update on the single site progress we've made, a detailed update later in the week. And just to say, all of us know this, I know this personally, how hard it is when people we know and love in our community or in our families, we can't visit them in care homes. It is a significant and challenging problem. It's one obviously we're looking at, but it's one that is applied across care homes. I know the province, as Dr. Henry has said, but we are conscious, I think, of the consequences of it for people, the real consequences for people, and for people, for residents of care homes and for families to not be able to visit. So sometimes special consideration has been given in the case of people who are about to or close to passing away, but in general these are very difficult rules to apply, and they show the challenge in what people have been facing in the care sector. And families being present in care homes means a lot to people, it means a lot to staff, and is generally something that we've encouraged over time, of course, and so it makes it very difficult now. But we'll be providing more information in detail on single site later this week, and we appreciate, I think, very much. I know I do, I know everybody involved, I know Dr. Henry does, I know everybody involved does, the consequence of this, not just in care homes, but in acute care hospitals, where there are significant limitations on visitors, which are required to keep everybody safe.
Tanya Fletcher, CBC.
Dr. Henry, with regards to the outbreaks at the poultry processing plants both in Vancouver and Coquitlam, assuming workers at that facility, at least some of them likely took public transit to get there, should we be worried about wider community transmission from public transit, for example, from those outbreaks?
Yeah, probably not. We never say never, but we took measures within the transit system as well to reduce the chances of people having contact. People have to be ill and spread it to others. So things like hygiene, things like maintaining the distance on public transit. And when we've looked at this, and these are some of the things that we've looked at around the world in trying to formulate, how do we safely go back to our new normal? And some of the things that we've looked at are where transmissions happen. And so they're very rare instances in public transit, mostly in China, before there was crackdown and spacing put in. So this speaks again to the importance of the physical distancing, the hand hygiene, the not touching your face, and in settings where you may have short-term contact within the 2 meters, wearing of a face covering can help as well. So it's not a high-risk environment, and we don't have any, there's no evidence that we've seen that there is spread through transit in British Columbia.
Next question is from Gordon Hoekstra, Vancouver Sun.
Well, hi, Dr. Henry. You've mentioned a number of times about the importance of contact tracing. I'm wondering if you could say, do we know how many contact tracers we have in the province now, and how much that is up from normal, and do we have enough?
Good question. I actually don't have the numbers. I can tell you that this is part of the bread and butter work of public health, and so we've been pulling in all parts of our public health workforce and supplementing it with others. So people that normally do this work are the public health nurses, our medical health officers, and really importantly, our environmental health officers as well, who are around the province. So we've been pulling them in from other work that they were doing to make sure that they're involved in this. And they're also supervising others that we've brought in, including medical students, residents who are doctors who are in their specialty training, nurses who are in nursing students, and others to help support and supplement the contact tracing around the province. So I don't have an exact number, but I know we've ramped that up considerably, and I am confident, and I hear from my Chief Medical Health Officer colleagues, we talk every day about how we're doing around this, and we're confident we have the workforce we need at the moment, and we have the capacity to surge up if we need to as well. But that is a really critical piece going forward, being able to detect people through our testing, to find them quickly, to be able to do that initial case management, we call it, and understanding of where the contacts may have occurred, and then finding those people. So that's all the things that we have been working very hard on and increasing our capacity to do, and we'll be monitoring that very carefully over the coming weeks.
Next question is from David Ebner, Globe and Mail. Okay, moving on. Jane Side, North Shore News.
Sorry, apologies. Thank you. Just getting it off mute. I was wondering, Dr. Tam last week talked about Canada tripling testing as a goal to 60,000 a day from about 20,000, which is now up to about 24,000. What is the plan in British Columbia to increase testing?
Yeah, so we have increased our capacity quite a bit. We were about 7,000 a day, but I think the capacity and where we test and who we test are different things. So we don't want to, right now there's no value that we're aware of anywhere for just randomly testing asymptomatic people in the community with the diagnostic tests. We do, and we've talked about this before, want to do some systematic testing in our community of random sample of people with a serology test, which tells us whether there's antibodies at some point, and we have a strategy for doing that. But currently, the testing that we are doing to diagnose this illness, we are testing very aggressively in places where we have outbreaks, like our correctional facilities, long-term care homes, the poultry outbreaks that we've had, and anybody in those environments, and also anybody who's a close contact, so a family contact of somebody who's ill. We've been testing them regardless of whether they have symptoms. But in our community, what we want to do is be able to detect anybody with symptoms. So so that is why we have opened it up. Anybody with a respiratory symptom across the province is now able to be tested, and we have the capacity to support that across the province as well. So I don't have any specific number that we need to do just for the sake of meeting a number. What we want to do is make sure we have the capacity to test everybody who needs it, and currently we do. Even though we've opened up the capacity, we've increased the number of tests we're doing. We're still about 3,000 a day. But it reflects a number of things. It reflects the fact that we don't have as much respiratory illness in our community anymore because influenza has faded away for the most part. So yes, we now have a much higher pre-test probability that if somebody is sick with respiratory illness, they might have COVID-19. So that's where we're focusing our testing. So we don't, in my mind, we don't need to have a specific number per day. What we need to be assured of, and what I need to be assured of, is that we're testing everybody who has respiratory symptoms and that they can access the test and that we can follow up with them quickly. So that's what we're focusing on here.
Jane Side, North Shore News.
Hi, Dr. Henry. I have a question about the urgent and non-urgent opening up of the healthcare system. I've been hearing from some people who say that they're waiting for things like a diagnostic cancer surgeries, I'm assuming some sort of biopsies, and that they have not been able to access those. And they're questioning, how long they're going to have to wait, considering that there's relatively few people in hospital with COVID-19 at this point. Wondering, when there can be more opening up of the healthcare system, especially in hospitals, and also wondering if there's a difference in terms of how different hospital sites are treating those urgent versus non-urgent procedures at this point.
Yeah, so there is a provincial strategy for that currently and will continue. So there should not be differences by hospital. Having said that, it depends somewhat on the capacity in the specific hospitals. And I know for one, cancer surgeries have been prioritized and continue to happen. And maybe Minister Dix can answer.
Yeah. They have been. I think you make a good point, though, Jane. I mean, there's a specific circumstances in the area that you report on at Lions Gate Hospital, and there has been for some time because of just an outbreak protocol there. But so those would be in effect where that's appropriate. But absolutely, the point you make is an important point, and it's part of our consideration as we develop the next or the plan, the surgical and diagnostic plan coming out of these weeks and talk about resuming elective surgeries. It's important that we also consider urgent surgeries that are the result of various screening programs, testing programs of various kinds. So you're quite right. This is a consideration, and it's a central part of the consideration of the team led by Michael Marchbank, really our whole health system under the direction of the public health officer, the deputy minister, and others, is to ensure that we address those questions as well. Because I think what's clear is urgent surgeries, of which we've done in the neighborhood of 12,000 now, urgent, elective, and urgent emergent surgeries or emergency surgeries. Those surgeries I think are relatively up to date in those categories. But if we're doing less testing and less screening, there may be an unknown number of people who will require exactly that sort of priority surgery in the coming weeks. So these are considerations, and that group of people that you refer to is very much in our thinking.
Next question is from Mike Potestio, Kamloops This Week.
Hi there, Dr. Henry and Mr. Dix. Thanks for taking my question. Curious, of the 103 deaths from COVID-19 so far in the province, how many have occurred in long-term care homes and assisted living facilities?
Yeah, and I don't know if I have that right in front of me today, but the majority of them have. I think it's up to 68, but I can get you the exact number, but certainly the majority have. This is where I have to put my glasses on. So, sorry. Yeah, 64. 64 of the 103 deaths have been in residence of people in long-term care or assisted living.
Next question is from Nelson Bennett, Business in Vancouver.
Yeah, the question is for Minister Dix. Apparently, the community of Haida has just basically told everybody coming over on a ferry to get back on the ferry and leave. This is for people that don't live there. Can they do that? Can communities like Skidegate and other communities on Haida just tell people they can't come?
So this is part, of course, of our relationship with First Nations communities and their self-governance and self-determination, and they do have the ability and the authorities to make those decisions for their communities. I don't know if you want to talk to that.
Yeah. That's exactly right, and obviously Minister Farnworth, who is in charge of the emergency side of our COVID-19 response and the state of emergency, is working with all communities, First Nations and others. But I think what Dr. Henry has said is the case, but we're going to be continuing to work with all communities. And you saw this last Monday when we put forward our plan, and it's a very important plan to provide services to both Indigenous communities and non-Indigenous communities across rural and remote communities in terms of getting access to medical care. So this is ongoing work we're doing together, and I'll certainly look to Minister Farnworth to give you a more detailed response.
Next question is from Les Lane, Times Colonist. Les, are you there?
These numbers.
Les? Okay, let's move on and we'll come back. Keith Baldry, Global News.
Hi, thanks for this to both of you. Question arising out of Minister Dix's comment at the beginning about how difficult it's going to be to come out of this, because we've never been in this before, so there's no real rule book. And given your point, Dr. Henry, that you've actually closed very few businesses in terms of percentage, much less than elsewhere in the country. So are you concerned that we might not actually be able to get out of this because you don't have a lot of levers to sort of pull here to get businesses to reopen?
Not at all. I think we all need to be in that, people are paying attention, and we need to be at that point where our numbers are coming down. And today, with 11 new positives, with the amount of testing we're doing, that is a really positive sign. So we're getting to that place, and I think people in British Columbia are waiting to make sure that we're not going too fast and that we're not going to undo all of the important work and sacrifice that we've done in the last few months. And we are putting together, as we've talked about over the last week, the parameters for which we think it is that we need to have in place to make sure that we can open up safely. And I know many of the retail shops that have closed, many of the other facilities that have closed that have not been ordered to close are doing so because they want it to best protect their employees and best protect their customers. So now we need to start thinking about, okay, what is it going to look like within the parameters of being able to continue social distancing, having smaller numbers of people, maintaining the appropriate hand hygiene and cleaning that we need in an environment, not having those meetings, having some hybrids of working at home and working in maybe smaller teams that are in the office or in the facility at different times. And really, really key, and I talked about that a little bit today, is the importance that it is for employers to make it okay for you to stay home if you're not feeling well right now. How important it is to protect your employees, because that protects your business. It also protects their families and our communities, because when people are working sick and they're together and they spread it to each other, they take it home to their families, and their families may work in long-term care or in healthcare. We've seen this happen in the past few weeks. So those are the mindset of enabling our employees, the people who work in our sector, to stay away if they're ill, or to work from home if they're not feeling well, so that we are maintaining that bubble that we have here in BC and not allowing the virus to spread. So those are the important considerations, and I think people will be ready when we get there. And we're going to be moving along slowly and thoughtfully and safely in the coming weeks.
Next question is from Rob Buffum, CTV.
Oh, thank you for taking my question. Just following up in relation to schools, I was wondering if you can tell us specifically whether it would be this week that we'll be hearing about dates for that. I also wanted to confirm, if I understood correctly, that primary age students would be the most likely to return first. And I guess finally on that front, I'm just wondering what your thoughts are on the likelihood that students will be back in the classroom for the most part this school year. Thank you.
Yeah, so no, we do not have a date yet, and we're not going to announce a date until we're ready and we have the plans in place. I have said that the focus will be on particularly the children of essential workers and those who need to go to work as we start to increase the businesses and workplaces that are open. So the focus would be on it, and of course it's interdependent with being able to ramp up our healthcare system again. So that'll be the focus. focus for the coming weeks and months. The decision has not yet been made about how much and what will happen in the near term. I believe we are not thinking. I think it's safe to say we're not thinking about school over the summer, but we want to make sure that we have really plans that address all of our issues for the fall. I expect that there will be some children coming back to school before the end of this session, but what that looks like is still being worked out. And there's some really great innovative ideas that I know some schools are doing already, and other schools are looking at. There's been a huge push on some of the distance learning that is working really, really well in some areas for some students. So it's going to be a hybrid and a mixture, and I think we have an opportunity, particularly to support those children of our essential workers and those who really need the support in the coming months, and to do it in a small scale and help us understand how it could work until we have a larger scale coming in the fall. So not more specific than that, but there's a lot of thinking going into it, which I think is really great, and lots of great ideas from the different school boards and school districts around the province.
Okay, we have time for a couple more questions. Next is Lisa Euston, News 1130.
I don't know if this is for Minister or Dr. Henry. With this talk about people going back to work and saying that it's vitally important that people stay home if sick, is there going to be any order, or can there be any labor law change that enforces paid sick leave, that people will feel like they're not losing out financially if they stay home?
Yeah, that's a good question. I cannot answer that.
Well, again, we're not announcing these issues today, as we said, although obviously all of them are being worked on. I think it's fair to say that of all the things, if there's a hierarchy of measures that are important, not working sick is at the highest level of importance. I think we can all agree with that, and we've seen renewed evidence of that in the last 7 days, of the importance of employers not insisting that people work sick, or that workers not working sick. And that is going to be a fundamental change that's really going to be a key part of any strategy that one could possibly think of with respect to dealing with COVID-19 until there's some form of community immunity. I might add that working sick is not a good idea under any circumstances. So you can imagine that that will be a significant part of our thinking, how to address that question. But we're not laying out our plan today, but I can tell you what you've identified, not working sick, is a critical part of anything that Dr. Henry or government or anyone else is thinking about, because it's one of the most important things, absolutely important things, that we have to ensure people don't do during a COVID-19 period when there is no vaccine.
So we have time for one more question today. For any reporters that didn't get to ask a question, there will be a statement released later this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the Provincial Health Officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Marc Antoine, CBC Radio Canada. Go ahead.
Yeah, hi. Could you provide maybe a little bit more details, or I don't know, kind of a glimpse of the gradual steps of reopening? You mentioned the Made in BC plan. If you can provide these in a little bit more details, and offer an answer in French as well.
Sure, I'll start in English and say the details will be coming. We've been foreshadowing a lot of the important things, including the structure that we will have in place, and the fact that all businesses will, some things will not change. We're not going to go back to having lots of people together in enclosed spaces and having meetings and having those opportunities where people can mix and mingle and transmit this virus amongst each other and then bring it home to their families and their communities. So within those parameters, there is a lot that we can do, and there's a lot that's happening already, and they can be used as a good example for people to think of when we're looking at opening up more businesses in the coming weeks.
Oui, juste pour dire que nous n'avons pas fermé l'économie autant que d'autres provinces, que d'autres juridictions, que ce soit des États aux États-Unis ou des autres pays ou des autres provinces, parce que nous avons suivi une démarche scientifique sur ces questions. Donc, la semaine dernière, on a ajouté des régulations pour guider des gens dans certaines industries et qui continuent de s'opérer. Mais il faut dire que donc, nous allons présenter dans les semaines qui viennent un plan fait en Colombie-Britannique pour la Colombie-Britannique, pour notre propre pandémie. Mais ce qui est important, que nous avons suivi une démarche de moins d'ordre, si vous voulez, mais de prendre très au sérieux ces ordres et d'agir selon la science, c'est-à-dire de ne pas d'agir, j'espère, dans le bon moment et après une considération considérable. Donc, c'est ce chemin qu'on va suivre dans les semaines qui viennent. Et donc, il faut attendre d'autres renseignements dans des jours et des semaines qui viennent. Merci beaucoup. Thank you very much.
That's all the time we have. Thank you.